according to a report for SAGE, the government's official scientific advice committee for the pandemic, the proportion of people in England with COVID-like symptoms who have got a test could be as low as 10%. And if they test positive for COVID, the proportion who follow self-isolation rules fully is currently estimated to be less than 20%. The figures may be over-pessimistic, but there is no solid basis for clear optimism about the big majority of those who should do so, seeking a test, getting prompt results, reporting contacts, and then the infected and the contacts self-isolating. Infection figures in Britain have risen since early July and more steeply since late August, while hospitalisations and deaths continue to decrease. There may be many factors in these apparently conflicting trends. Increased testing, more false positives, more of those testing positives being young people who've picked up the virus from the holidays and openings of pubs and cafes, which seem to have fuelled infection rises across Europe. And there being a delay until infections spread to the more vulnerable elderly. It is unlikely, though, that the trends will remain in conflict. Virus control efforts and the NHS will come under new stress in the winter and in the run-up. The social measures needed to underpin and facilitate serious virus control policy are still lacking. Scraps of them have been conceded by the Tories only under pressure. The unions and the Labour movement must apply more pressure. That means full isolation pay for all, not just Matt Hancock's feeble £13 a day for some lower paid workers in some areas. As of now, only about 40% even of care home workers have access to full isolation pay. Rebuild the NHS, a good pay rise for all, and a big increase in budgets. Take all private hospitals into the NHS, rather than just paying them to provide overflow facilities, as the government is now doing. Bring the privatised NHS logistics into public ownership and control, and requisition industry to ensure supplies. Bring care homes and domiciliary care into the public sector, with staff on public sector pay and conditions. Run testing, tracing and isolation as a local public health operation with adequate funding to do that, instead of the current contracted out Serco-Citel mess. In mid-July, the government received a report commissioned by its chief scientific officer, which warned that July and August were likely to be a lull in the pandemic, followed by new spikes over the winter. Even if this virus is not seasonal in the way some others are, the fact of people spending more time indoors in winter will boost infections. The usual seasonal rise of flu will make it harder to trace chains of SARS-CoV-2 infection and put pressure on the NHS. The report urged the government to use the July to August lull to get preparations in place for the winter. At first, it seems the government just didn't read the report. Boris Johnson blustered about life being back to normal for Christmas. Then the ministers read it, or someone who had read it caught their attention. The government put on the brakes about lockdown easing, though only after it had reopened pubs and cafes, known to be possible virus transmission hubs, on the 4th of July. The government has also increased the volume of testing, though the organisation of it remains a largely contracted out mess, rather than a proper public health operation. But little else has been done during this period when virus hospitalisations have remained at a low level, though thanks to the reopening of pubs, cafes and tourist activities, infections have increased across Europe. Now, Health Minister Matt Hancock is warning, obviously enough, that the current quick rise in infection numbers since late August will feed through, sooner or later, to one extent or another, into more hospital cases and more deaths. At the same time, the government is pushing to get more office workers out of the work from home mode and back into offices. They are demanding that 80% of civil service workers be back in their offices by the end of September. Not so that they can work better, no, so that they can pack into pubs, cafes and shops of the city centres, the buses and the trains, and so spread infection. The Tories want to be able to end furlough pay at the end of October and minimise the consequent unemployment spike. Over 3 million workers are still on furlough. The Labour movement should demand the continuing of full furlough pay for many months yet, rent holidays for residential tenants and for small businesses, and a great expansion of public services which will provide good new jobs. At the same time, schools are being reopened, universities are restarting, and the government is encouraging more passengers for public transport. Each of reopening schools, refilling public transport, and even restarting universities may be possible to do without setting off a new spiral of infections. But each one is bound to add something to the infection figures. To do a back to the office drive at the same time, and while positively encouraging people to crowd into pubs and cafes, is foolish and short-sighted. The NHS and the virus precaution system needs to be rebuilt now, while we still have time for winter. Ever since 2010, and before that too, the NHS has been run on the basis of cutting to the maximum as long as it can just get by. It has been routine, even in ordinary winters, for hospitals to be at 95% capacity. Care homes the same. A recent report showed that larger, fuller, less staffed care homes have had more COVID deaths. In other words, the more cost cutting, the more deaths. But the drive has been for cost cutting. The Labour movement must fight for the rebuilding of the NHS and of social care, with good pay rises for all staff, with all jobs taken in-house and all contracting out reversed. And above all, we must fight for worker control at every level. The Tories and the bosses cannot be trusted. Only the workers in each workplace and industry have adequate motivation and adequate interest to keep us safe.